Hello, I'm going to talk about asthma today. Asthma is a small airway disease. The risk factor for asthma is the pollutant like a pollution, paint, the people who are exposed to paint or allergic to paint, pollens is a common reason. Smoking is another common reason for asthma. Even a second hand smoking, if like let's say if the parents smoke, even if they smoke outside, they come inside, they have a irritant attached to their clothes which can cause allergy in the baby. As stress is another reason which increases inflammation inside and can cause asthma. Aspirin, many times in adults, simple medication like aspirin is shown cause it has seen that it has caused asthma in few people. In babies, the GI reflex can reason for asthma. We do see that asthma, eczema, and allergies are like interconnected somehow. Don't know the reason about it, but if in a families the eczema is there present to some of the parent or grandparent, many times the babies may get asthma. Allergies are there, then they can next generation they can get eczema. It's kind of interrelated. Let's talk about little pathology about the lungs, what happens in asthma. So we have a trachea, bronchus, bronchioles, and then we have a little alveoli here. So this, like we say, it's a small airway disease. So it's a disease in a small airway, not in the big airway, but these are the small airway where this can happen. And if you see, this is a lumen, this is a cross section of this area. If we take this, there is a lumen inside, in between there is a smooth muscle. You see the green, these are the smooth muscles, and then there is a mucosa inside which is a purple color, and the mucosa has a glands. This mucosa secretes the mucus which sometimes we cough up, and it kind of lubricate the airways. So if you see here, these glands are there, and there is a in between the space which is actually where the air goes in and comes out. What happens in asthma, there is the smooth muscles, they get inflamed, there is edema here, and the mucosa also get inflamed. The size of the air inflow and going out is actually reduces. So the baby or the whoever has a asthma will have a problem in breathing in and breathing out. Most of the time this problem, you always see a wheezing there, and wheezing is the problem during expiration. This is one thing we need to remember. In asthma, the problem is during expiration. They can take the air in, but while expirating the air, there is a spasm and there is a problem in removing the air from the lungs, and that gives a wheezing sound. So wheezing is heard during expiration, and they have a trouble getting breathing out. That's the big thing they have it, and short, which causes a shortness of breath. Inhaler is the one which is used very commonly, and it actually opens up the airway. So while we are talking about this, let me talk about the medication. So we have two type of medication. One is called rescue medication, which we give it when they have an attack, and the long term control, the medication, these are given so that they won't have an attack later on, and those are the long term medication. The short term, in a rescue medication, we have a short acting B2 agonist. These are the one which actually causes a bronchodilation, and those, one example is Proventil. These are sympathomimetic drugs, right? These are the medication which stimulate the sympathetic nervous system. So these, the side effect of this medication is increased heart rate, and heart rate we need to watch for that because it's a sympathetic stimulants, but it also have another effect, bronchodilation, so it gives immediate relief. We have anti-cholinergic. This medication decreases the bronchospasm and given as medical dose inhaler. The example is Atrovent, which is given as a it's a meter dose inhaler. So it's given with inhaler, and it gives immediate relief. And then we also give a steroids so that prevent inflammation. So this is given when they have an attack. Then we have a long-term control. This medication, in this we give a corticosteroid, long-term B2 agonist, and these are also sympathomimetic, or in other way it stimulates the sympathetic nervous system. But here we are giving it to cause a bronchodilation. Very good medication, but it's not good for short-term use. So this is basically to control the asthma. For example, we have a formoterol and the salmeterol. The action of this medication starts actually in 30 minutes, so it won't start immediately. It takes 30 minutes, but it remains there for a longer time. So for 12 hours, the effect will be there. Side effect, again, because it's sympathetic stimulant, it causes an increased heart rate. The other medication is Lycotriene Modifiers. This is also a very good medication. We have a singular example, and it prevents a bronchospasm. It decreases this smooth muscles inflammation, right? So it decreases inflammation slowly, and this inflammation. So these are the long-term medication. Okay, so baby takes those all the time, or whoever has asthma, and then when they get attacked, they need to take this short-acting B2 agonist. Okay, if you have any question.